Hi, everybody. I really want to extend my thanks to Kevin, Judy, and Sarah for inviting CMS to participate in the symposium. We are here to try to convey how we look at the documentation documentation burden, really, just generally, but also try to get to broaden our thinking about how we can actually be part of making things better. We recognize 100% that our contribution to the ecosystem that's creating this burden is the plethora of requirements we have out there. And so one of the things that we've been working on quite a bit in the last couple of years is trying to pick away at documentation requirements, some reporting requirements as well, either trying to simplify them, clarify them, or literally get rid of some if they're just no longer relevant anymore. And even with reporting requirements, trying to align some of these reporting requirements more and more across provider types, but across our programs as well. So I want to start off just by telling you just a few things about the new Office of Burden Reduction and Health Informatics, because we just stood that up in July, and the purpose of it really was to make sure that we continue to consolidated effort to reduce burden, but also to kind of broaden our thinking about what we could potentially do. And then I'll give you some insights on how we look at the documentation challenge itself. So our office is responsible for working across CMS and working with the medical community to literally reduce administrative burden in the health system. So it's not reducing administrative burden within CMS, it's literally outward facing. Even if we fix something in CMS, how it's actually impacting the external community, the medical community. And we didn't start this from scratch. We brought 3 existing teams together with their existing book of business. So the patients over paperwork team that was working across the agency on policy changes, they came over, the interoperability team came over, and our HIPAA national standards team came over as well. So just by collecting these 3 teams, we have 3 teams whose focus day in and day out is really to reduce burden, whether it's through policy changes or operational efficiencies. But all 3 have that enterprise view. National Standards Group, their enterprises even cover entities that don't even participate in CMS programs. But even more importantly, all 3 teams have at their core engaging with external stakeholders to better understand what the challenges are or how they perceive the challenges, because our interpretation of the challenges might be different, what they're actually experiencing, but help us understand from their perspective what better actually looks like. So prior authorization and documentation requirements, whenever you go out and ask what the biggest issues are, those 2 are usually top of the list. I'd say in about the last year and a half, we heard definitively, let's just put it this way, they say prior authorization, the burden of prior authorization is worse than the burden of an electronic health record. Now, when you hear something like that, it's a pretty big deal. So we certainly jumped on that right away in an even more concerted effort. As far as documentation requirements, just generally, these are the kinds of things that we hear about our requirements, and just looking at the background materials that were provided, you're clearly hearing the same sorts of things, whether it's our requirements or others. But our requirements are hard to find. They are scattered across a bunch of different documents. They could be in an internet-only manual. They can be in a local coverage determination document. They could be sitting in a statute someplace. They could be sitting in a reg. They can be sitting in different websites, our contractors' websites. They can vary from region to region. The local coverage determination documents are an example of that. And it's not always clear what our most recent, absolutely true requirement is, what people are actually supposed to be operating against. And I think one of the other concerning things, although it's not surprising given the milieu I just mentioned to you, apparently, and it's not, our contractors don't always interpret the requirements the same way. So there's even variability on how our review contractors take a look at our requirements and then act on those requirements themselves. So that's what people say about our requirements. So imagine that you're in a practice and you're dealing with 6, 8 10 different plans and a variety of payers, and they all have different processes or different prior authorization processes or a different set of documentation requirements, your practice is suddenly spending a ton of time just figuring out what to do, let alone actually complying with the requirements that you do find. And so the other take-home issue here for us really is, we have this information maze. It's hard to navigate, but the maze in itself, the milieu that we're operating in itself, can have unintended consequences. And certainly clinician burden and burnout is, right there on top of the list. But there's the inconsistent requirements, or at least misinterpretation of the requirements, delayed services to beneficiaries at times, errors in claim processing, improper payments, barriers to interoperability, and certainly customer dissatisfaction. And that's just naming a few things. Now, that is particularly interesting because the reason why we have documentation requirements is to help us with the oversight of our programs. And it's oversight in terms of quality, safety, and program integrity. And here, program integrity, everybody thinks about is, trying to find fraud. Some people say some of the best documented records are the ones that fraudsters put in place because they just know exactly what they need to put in the records, right? But making sure that claims are paid properly, are paid accurately is an important part of program integrity as well. Every year we have to report out on what our improper payment rate is for all of our programs. Guess what's the biggest cause of improper payment rates? Not having the documentation requirements. Well, if you can't figure out what they are, if you're not sure what you're exactly supposed to be doing, even if you find them, it's not surprising that people aren't documenting what they're supposed to. And so now we have these improper payment rates, a good part of which is related to not having the documentation requirements. So this slide is trying to depict the tension or the challenge, or really the balance that we need to achieve in what kind of requirements that we actually have out there, and the value of those requirements. And the tension really is what is needed that's clinically relevant. And when I say clinically relevant here, I'm just saying it's good clinical practice. Clinicians do it. It's probably being documented in the course of clinical care. And then what is the extra information we might need for our oversight responsibilities? And one of the questions here is, where are we on this? Are we, too much focused on and have way too many requirements in the oversight area, and not maybe taking advantage or benefiting with from what's already documented? Or should we be in the middle someplace? Or what does it even mean if it's the other way around, that the focus is really on what is clinically relevant that's already documented in the system, and what is just that small bit of extra that we might potentially need? And that's what I want to just show you in this last slide. And it's kind of our mental model of, when we start looking at certain areas of documentation requirements, or certain areas of prior authorization requirements, we ask ourselves, or we ask the team that owns those requirements, what's truly clinically relevant? What is that little bit of extra that we really might need for our oversight, so we feel like all is going well? And all the rest, how much of the rest do we really need? How much of that could just actually go away? And it's fun to get into that bucket, because when we talk to stakeholders about that rest is not just our requirements. It's very often the provider organization's requirements as well. And the last thing I had up there before I hit the slide accidentally was, we are also, in addition to try to break down the questions so we can look at the requirements a little bit more systematically, we're trying to figure out a way to create a repository or a resource that's a single source of truth, so it's easier for providers to get to the content and make it more understandable. All right, Kevin, that's it for me.